It's tretinoin, tranexamic acid, and hydroquinone are the top three products, along with maybe a little bit of vitamin C, but really those I feel like are the main pigment controllers. So can you break down for me the differences between hydroquinone and tranexamic acid and why you would choose one over the other?
Yes, I will certainly try. So, hydroquinone is probably has been the gold standard in pigment control for many, many years. And in many countries, it's prescription only. Some countries, it's available over the counter in lower concentrations. But there are potential risks and side effects associated with it as well. But it's what we call a tyrosinase inhibitor. So, tyrosinase is an enzyme that is required for our melanocytes to make pigment. And so, that is why hydroquinone has traditionally been the most effective treatment we've had, especially from a topical point of view, to try and block those little melanocytes from making their pigmentation. And then, cell turnover and our macrophages will kind of clear up the pigmentation that's there, so long as we're not overproducing it. In more recent times, we've moved a lot towards tranexamic acid. Now, tranexamic acid is a very interesting medication. It's traditionally what we call an antifibrinolytic, which is designed to help people clot their blood better, essentially. So it's mostly used for patients that are bleeding in surgeries or post-childbirth, and also used very commonly for women who have very, very heavy periods because they're prone to bleeding too much. Now, what happened was that women who were taking this tablet during their period cycle every month noticed that their melasma was getting better. And a great medication, generally very, very low risk, although we would recommend doing screening to make sure that you're not overly prone to blood clotting before we would use tranexamic acid. And so that is often used as an oral agent to help melasma. Obviously, as we realized, hang on, why does this help melasma? Initially, no one really knew, but it was then developed more into topical preparations as well. It's quite hard to formulate with topically, I understand, because it's a big molecule. So you need the drug to actually penetrate deep enough to that deep layer of the epidermis to be effective. But, with the right formulation, they seem to be quite successful in getting it as a topical. So how does it work? We don't 100% know, but it seems to affect the inflammation, so sort of plasmin-mediated inflammation in the skin, and potentially reduces the vascular growth factors in the area. And they, as I said before, it's kind of this vicious cycle that causes melasma of these sensitive overactive melanocytes, but these, the increased vasculature, increased hormones, and this sort of vicious cycle of everything contributing to the pigmentation. So if you can cut back on the cause of the triggers, then that's how tranexamic acid seems to work, that it's actually down-regulating the inflammation that drives the melanocytes to produce pigment, versus hydroquinone, which is kind of stopping the melanocyte from doing its little job. Hydroquinone can be irritating. It tends to be more irritating, especially if used in high concentrations. So some people can get irritation, and then that can drive more pigment production from our melanocytes due to the inflammatory cycle, and or due to post-inflammatory hyperpigmentation. So that is a risk. And then there's also this thing called ochracnosis, which is a condition where you get a sort of blue staining in the skin due to overuse of the drug hydroquinone. And that is seen quite commonly in countries where it's not regulated and people use it for long periods of time at high concentrations. And that can be a type of pigment that's very hard to get rid of. So generally, for those reasons, we've always recommended cycling hydroquinone so that you're not using high concentrations and not using it all the time. But having said that, it is generally a very safe treatment at the right concentrations. Tranexamic acid, again, from an oral point of view, if we're taking it as a tablet, we tend to cycle it because we don't know, essentially, whether there's any long-term risk taking it over, very long periods in terms of increased clotting or other side effects. But as a topical agent, there's no real reason we need to cycle it. My preference generally is a shorter course of topical hydroquinone and oral tranexamic acid together. And then for maintenance, I'm transitioning to topical tranexamic acid and retinoids. So, if we can maintain it with all the right things, being very strict sun protection and the right skincare, you may not need to cycle back onto your oral formulation or your hydroquinone, but that's every individual. Some people need to do that every summer. They just flare up in the summer, and we'll so kind of treat them with the heavy-handed stuff over the summer months and maintain it over the cooler months with the other topicals.
You mentioned retinoids. Tretinoin, I probably owe my entire recovery of melasma to tretinoin, and I know that there's kind of mixed opinions out there. If you search tretinoin and melasma, some providers love it. Some are like, nope, it flares it up, it irritates the skin, it worsens melasma. What are your thoughts on retinols, tretinoin for the treatment of melasma?
Yeah, so retinoids as a group help normalize cell turnover. They help sort of the structural integrity of the epidermis and dermis. So they tend to normalize the skin function and generally reduce inflammation at those deeper levels, but can be irritating in themselves for the skin barrier. So it's always proceed with caution, and you're better off going very low and slow to build up so that you can tolerate it. But I agree with you. I think that they one of the gold standards in anti-aging for a reason, because they help pigmentation, but also skin quality, fine lines, wrinkles, and general skin health. So healthy, sort of non-inflamed skin with good structural integrity seems to be helpful in controlling melasma. And I would say they are still one of the gold standards in maintenance and helping to clear that pigmentation out as well.